Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Radioactive iodine. So in the radioactive iodine has many isotopes are used, like iodine 127 or iodine 131 are used. Iodine 127 is actually a stable isotope. It is a stable isotope, and thus this iodine 127 is not used as anti-thyroid drugs. So because of this, the iodine 127 is not used as iodine anti-thyroid drug. So iodine 131 is used as an anti-thyroid drug. So this iodine 131 is a radioactive with a half-life of around 8 days. Mechanism of action of iodine 131. Iodine 131 is concentrated in thyroid follicles, and thus this iodine 131 will release two things. It releases beta rays and it also releases gamma rays. Okay, these beta rays will cause destruction. These beta rays will cause destruction of the thyroid gland. Then what are the advantages of using iodine 131? Iodine 131 can be used in older patients of more than 35 years of age. It can be used in coronary artery disease conditions, because actually in a patient with coronary artery disease, going through surgery is a risk. So it can be used in coronary artery disease patient. It can be used if the patient is unfit for the surgery. We can use this iodine 131. It can be used in ectopic thyroid. Whenever there is ectopic thyroid mass or for tumors, we can use this iodine 131. It is also used as a non-resectable thyroid gland. Then drawbacks of iodine 131. In drawbacks of iodine 131, it takes around 3 months for action of iodine 131. The main contraindications are: it is contraindicated in children, and also it is contraindicated in pregnancy because it is a radioactive substance. It is also contraindicated in ophthalmopathy because it causes progression of ophthalmopathy. The main side effects of this iodine 131 is it can cause hypersensitivity reaction. Because it can cause hypersensitivity reaction, adrenaline should be available nearby while you are giving this iodine 131, and it is carcinogenic. Then this iodine 131 or radioactive iodine, it can cause Wolff-Chaikoff effect. Wolff-Chaikoff effect is the iodine induced hypothyroidism. Wolff-Chaikoff effect is due to this iodine, radioactive iodine. If the patient develops hypothyroidism, then it is called as Wolff-Chaikoff effect. It can also result in Jod-Basedow effect. In Jod-Basedow effect, this is actually because of the usage of radioactive iodine. If the patient develops hyperthyroidism, then it is Jod-Basedow effect. It can also result in irreversible hypothyroidism. It can cause sialadenitis also in the patient. So these are the side effects of radioactive iodine. Then there is one more important thing is this radioactive iodine can cause secondary cancer. It can cause secondary cancer, like it can result in papillary carcinoma of thyroid most commonly.
thank you and thank you for watching.